What is monocytes high? Monocytes are a type of white blood cell that plays an important role in the body's immune system. They are responsible for identifying, attacking, and destroying foreign invaders such as bacteria and viruses. High levels of monocytes can be indicative of an underlying infection or inflammation within the body. What is high monocyte count? Monocytes are white blood cells that help fight infection and are part of the body's immune system. A normal monocyte count should be between 200 to 800 cells per microliter or mcl of blood. If the monocyte count is higher than normal, it could be caused by an infection or inflammation, typically with conditions like tuberculosis and rheumatoid arthritis. Definition of monocytes high levels mean. Monocytes are related to white blood cells which play an important role in the body's immune system. Monocytes are responsible for identifying and destroying microbes, including viruses and bacteria, that invade the body and cause disease. Monocytes are large in size, making them more adept at seeking out and engulfing foreign particles or pathogens as part of the process known as phagocytosis. High levels of monocytes can be indicative of a wide range of illnesses such as HIV/AIDS, tuberculosis, or even cancer. Causes of high monocyte counts and monocytosis. Monocytes are a form of white blood cell that is responsible for fighting infection and helping maintain healthy immune systems. An elevated level could be caused by a variety of conditions, including infections, chronic diseases, and certain medications. Infections such as HIV or hepatitis C may also depend on the cause of high monocyte levels due to the body's response to fight off the virus. In addition, autoimmune diseases such as lupus can lead to increased production of white blood cells including monocytes. Symptoms of high monocyte counts. If you're experiencing any of these symptoms, it's important to contact your doctor right away so they can conduct tests to determine if a high monocyte count is the cause. Your doctor may recommend a complete blood count test as well as other tests such as an X-ray or CT scan if they believe there could be an infection present. Treatment will depend on the diagnosis and could range from antibiotics to chemotherapy drugs if cancer is present. Diagnosis and tests for absolute monocytes. The diagnosis of monocytes high is typically done with a complete blood test. This test measures the amount of red and white cells in the blood, as well as other components such as platelets and monocytes. The doctor may also order other laboratory tests, such as a differential count, to identify the types of white blood cells present in the sample. Imaging tests such as X-rays and CT scans can also provide further information about what might be going on inside your body. Treatments for high monocytes levels. Treatments for high monocyte levels typically involve treating the underlying cause and avoiding triggers that worsen symptoms. Infections and inflammation may require treatment with antibiotics or other medications to reduce the monocyte value. Preventing monocytes high levels. High monocyte levels can be a sign of illness or infection, so it's important to take steps to prevent your levels from becoming too high. The first step in preventing high monocytes is to maintain a healthy lifestyle. Regular exercise also helps reduce stress, which has been linked to higher monocyte counts. Another way to reduce the risk of high monocytes is getting adequate rest each night. Associated conditions for monocytosis. Some associated conditions may include chronic illnesses such as HIV or AIDS, autoimmune diseases like lupus, and inflammatory diseases like rheumatoid arthritis. Additionally, people with cystic fibrosis, leukemia, and multiple myeloma may experience higher than normal monocyte levels due to their underlying health issues. Other conditions such as bacterial infections can also cause elevated monocyte levels due to their effect on the body's immune system. Risk factors. It's important to speak with your doctor if you have any concerns about your monocyte values so they can do a full workup and determine the cause. In some cases, lifestyle changes such as diet modifications or exercise might make a difference in reducing monocyte levels back to normal range. Conclusion: monocytes and macrophages. To conclude, it is important to monitor monocyte levels to detect potential health problems early. Those with higher levels should speak with their doctor to better understand their condition and determine the best course of action.